Georgia. And yeah, we should be live right now. So welcome to Back Talks with Dr. Sean McWilliams, where it's so nice to have you here. And let me pull up here so I can see if anybody says hello. So we've been doing a series on how to manage back pain from an invasive perspective, and also natural options that you have as well that are more holistic in their approach. We've been talking about epidurals. We've been talking about facet injections. Last week we talked about ablations, and this week we're talking about microdiscectomies. So just wanted to say hello to everyone. It's great to have you here, and hopefully you guys can see. Sometimes on this I can get a little wonky, so just want to make sure that you can, you know that we're live. And I'm just checking on mine really quick and make sure that it's working. So switch to that. Switch to that. Yeah, here we are. All right, we're in business. So if you got a comment, say hello, please. So microdiscectomies. What is a microdiscectomy? Well, let me show you what a microdiscectomy is. So a microdiscectomy, we're going to talk about unlocking the truth. I'm going to give you the pros, the cons, and your non-invasive options. A microdiscectomy is a surgical procedure that's more invasive, that is used to go in and cut out a bulging or herniated disc. That is it in a nutshell. And I'm going to show you some pictures of this here in a second. Here you can kind of see a little bit of a picture of what they're doing. So are there pros? Are there cons? There are. So let's go over some pros and cons for you. So pros is you can actually go in relatively within an hour and you can cut out extruded disc material, which is jelly that's come out of the disc. It can offer pain relief, and for some people when they wake up they're pain-free. So I've got to give credit where credit's due on this. Healing is usually faster than a more invasive surgery, like a fusion, for instance, because it's a much bigger scar, it's much more invasive, and you wind up with a lot more scar tissue as well afterwards, which can cause you all kind of complications down the road because that stuff can be like spider webs. So those are some of the pros, though, and I'll show you what the scars look like. Some of the cons in doing this is that it's an invasive procedure. You are asleep for this procedure. You can get nerve root damage, which means it can cause major issues going down into your nerve, especially like in your legs. You can get bowel and bladder incontinence, and in English that basically means you lose your ability to control urination and defecation. So you're peeing and pooping in your pants in basic English. You can get infection from this because, again, we're going into a much deeper level, cutting you open like that. And the problem is that a disc at the end of getting a discectomy is still in state of disease. So you cut out the bad part. So it's like, you know, if you drive up north and you got potholes, if you know what I'm talking about, you know, you can patch that up, right? And in a couple months, maybe a couple years, you know, it's a big pothole again because you're just kind of putting a temporary band-aid on it. And a lot of times for discectomies, that's the case, and it actually makes it worse. So if you want to do this, you got to look at ways of actually getting the disc to heal. So we'll look at this for a second here. Do a couple drawings. So when you're looking at a disc, there's a couple parts if you've been with me in the past, and I'll put myself up here so you can see me a little bit. So you have these outer bands that you see through this area that wrap all the way around the disc. That's called the annulus fibrosus, very tough fibrocartilage. In this area all through here is your nucleus pulposus. That is the jelly that's supposed to stay inside. And then here, if I blow that up for you, bring this down a little bit, this is where this person has a herniation at. So they have extruded disc material that has come out of the disc and is pushing onto this nerve branch and more than likely probably causing pain. So that's what they're going in to grab is this piece right there that we're going to go look at here in a second, okay? So how's it done? Well, they're going to use some tools. I got some tools here that I'll show you. So they're going to use a special tool that's going to go in here into the disc, and and it's basically going to snip the disc away. And they're also going to use retractors that go into here that take your spinal cord and nerve branches and try to push or pull them out of the way. Here you can see another view again where this is your spinal cord right here, guys. These are your nerve branches coming in information and going back down. And without getting too technical, they're going to try to push that stuff aside, and then they're going to use this very expensive and fancy straw that can cut a lot of times, and they're going to try to suck this glob of disc material into here and get it out of your body. So that's a microdiscectomy in a nutshell. So let's look here for a second, and let's do, you can see my tools here. So here you can see a close-up. This is a disc right here. You're looking at a bulging disc. Here's your nuclear material. The nuclear material has come out into this area, but it's still contained within the disc, therefore it's called a bulge. If that jelly has come out of the disc, as you see here, for instance, that is called a herniation right there at that point. And so what they're going to do is they're going to take a tool, expensive one, and they're usually going to be coming in to the cord and to the nerve, and they're going to be trying to pull this away, okay, so that they can get the neurological tissues out of the way. And then what they're going to do is they're going to be going in, exaggerating this a little bit here, but they're going to go in this area, and then they're going to be snipping out, not the nerve, but this disc material right here. And they're going to be trying to snip that stuff away and suck that out so it stops pressing on that nerve branch. And that's a discectomy in a nutshell. So if you get one done, you got to bring your checkbook. Even though insurance companies, a lot of them will pay for this, I don't really quite understand why when there's much less other expensive options, and I think much more successful options for people in the long run. The average cost of a discectomy, according to costhelper.com, is $20,000 to $50,000. So it's a good chunk of change. Okay, if you get one done, this is what you're going to look like at the end of it. So you're going to have some scar tissue right there. You're going to have a scar on your back. And depending on who the surgeon was and how big they cut open, how much room they need to get in, again, you're going to have scars on your back. So just keep that in mind. You're going to have a battle wound after getting this done, and obviously with the hopes that you're feeling better as well. So let's take a look, and this is a pre and post MRI, so you can see the difference in the disc here. So this is after a discectomy. So you can see right here, this was the herniated disc material, this black part on the L4 disc, and this is after the surgery. There is a reduction to it, there's no doubt about that. And so yeah, so you can do this stuff with that. But do you have other options? Do you have ways of managing a disc that's herniated like this without getting cut open? And the answer is yes. So, you know, if you follow me, I am all about holistic, natural approaches to health whenever possible. They're not always an option, but for most people they are, but most people don't know about these. That's the problem. So spinal decompression is still the most successful non-surgical treatment. It's so gentle. If you were just missed me on Instagram and stuff, you saw one of my patients giving a beautiful testimonial. So this table is incredible. And the amazing part is that you can actually do this from your home as well. And I'll tell you about that in a second. So is it successful? Yeah, if you were with me last week, I showed this because it's such an amazing study, and I'll put some more, but this is the Ghost and Nawasaki study. And this is percentages of spinal mobility. So your ability to move your spine properly, pain reduction, and activity after spinal decompression. So let's look at some numbers. Mobility, 71% of the people that went through spinal decompression on the table that I just showed you had 71% had improved mobility, 71% had improvement in their pain, 71% less pain. That's amazing, right? Activities, 78% improvement in their ability to move and get back to life again. And pain remission, this means people that had pain and then they followed them for a period of time who didn't have pain, 77% of them didn't have pain anymore after getting this done. That's higher than doing a discectomy all day long. And you don't have to get surgery in it. So you definitely want to consider computerized spinal decompression, and it really should be your first line of defense and your first option. It should not be number 6 or 8, it should be number 1, and surgery should be number 6 or 8 unless you're in an absolute emergency state. If you're going to go to a clinic and get it done, you're going to want to go to someone who's the best. I just show you this because you might not know me yet, but in 2019, 20, and 21, I was voted one of the top spinal decompression doctors in the entire United States for the work I did when I worked in my clinic full time. And now I'm semi-retired, and what I decided to do was to create a home course for people so that if you can't get to a clinic or you live somewhere in the world that you have no access to this, you could still do spinal decompression from your home for a fraction of the cost, and you got me to guide you and teach you on how to do it too. So you get all of this for something you can do at home in the comfort of your home. So let me show you a pre and post MRI of what it looks like after doing spinal decompression. So this was actually one of my patients. So here you can see a massive disc extrusion. This guy already went to someone who didn't know what they were doing spinal decompression wise, and unfortunately didn't help him. So, but they weren't certified in it. I have 6 national certifications in spinal decompression. Again, here you're looking at a view. So this view that we're looking at right here is looking like we're looking up inside your body. And so what's cool about it is that if I switch over to this camera right here, you're basically looking at yourself just like this. So spinal cord right here, back of the disc. And what you're looking at when I come back to this slide right here is all this disc material right there that was totally compressing a spinal cord. Here you can see the right nerve branch going down his right leg, which is white. Here you can't see the nerve branch at all, and he had sciatic pain going all the way down his leg. So this was pre-spinal decompression when he came to my office. This is his post-MRI. So I want you to be looking at this area right here, that area right there on this, and this is me helping this gentleman. Here, almost no disc material left at all. You can see such a huge, probably about a 70% resorption of that disc material. Now you can actually see a spinal cord. Now you can actually start to see the nerve branch coming off to the left, and that was all done without surgery. So I do these live to inspire you, to let you realize that unfortunately if you go to most surgical centers, they are not even going to offer you or talk to you about spinal decompression unless you bring it up, and most of them really don't know a lot about it anyway because they're surgeons. They learn surgery, right? They're not bad people, they're great people. Most of them want to help people, but this is big money. 20, 50, you go get disc replacements these days, you're looking at $100,000 to $500,000 surgeries, and they're doing them all the time. I've seen more disc replacements than I ever have in my entire 24 years of practice. So you got to be a smart consumer, and I'm trying to help you get to that point so you feel informed, you feel knowledgeable, and to inspire you to go and please try other alternatives such as spinal decompression. You can look up for Disc University. If you have a question, send me a message. I can send you a link to the course that I've been working for almost a year and a half on, and you can do it from the comfort of your home. And I think I can help you have such a better quality of life. So thank you so much for being here. I love and appreciate you. I'll see you next week at 1 o'clock.